All right. Well, thank you very much, everybody. We're gathered here on Treaty 1 territory in Manitoba to talk about how important it is, in fact, that it's absolutely critical to have investments in personal care homes right now and to help the residents of personal care homes who are struggling. I mean, we've heard from many family members as well as residents that they've been struggling enormously through this pandemic. But one of the most important things to realize is that this pandemic has really just revealed, it's been the tipping point or the straw that broke the camel's back when it comes to challenges in care in personal care homes for seniors. For many years, that personal care homes have been understaffed, that staff have been underpaid. This is not new. This is not something that happened just during this pandemic. It was there before the pandemic. It was before this PC government. In fact, it's been a problem for many years. I'll just quickly read from a document from the Long-Term Care Association from August to put this in context. They wrote that when the pandemic began in March, the regional health authorities, together with Shared Health, created a strong support, education, and information hub for long-term care operators. However, and this is in August, the Manitoba government and the regional health authorities have not committed to funding any COVID-19 related incremental costs incurred due to the guidelines, directives, and public health orders that supportive housing has been mandated to follow. I will add that they say for more than 50 years, appeals for operational infrastructure funding to upgrade and improve the physical care environment, especially for dementia care, infection prevention and control, and safety have been submitted and largely ignored. So that's part of what we're dealing with. And I want to add one other thing, which is the footnote just under that, which points out that because right now, the provincial government is saying that what's happening in Manitoba is not as bad as what happened in other provinces. We need to realize that Canada has had one of the highest death rates of seniors in care homes of any country in the OECD. Far worse than other countries. LTC residents in Canada accounted, this is from August, accounted for 81% of all reported COVID-19 deaths in Canada, compared with an average of 42% in other OECD countries, ranging from less than 10% in Slovenia and to 66% in Spain. So we need to recognize that when we're comparing what's happening in Manitoba to what's happening in Ontario and Quebec, that what happened in Ontario and Quebec was some of the worst response anywhere in the developed world. And our hearts go out to everyone who's been impacted by this, to residents, to their families who are supporting them and trying to help them, and to staff who've had to work under incredibly difficult conditions. So having said that, I'll pass it over to Eddie Callisto Tavares. Eddie, we've known you for a number of years, but I know you've been a champion for your father, but I'll hand it over to you, Eddie.
Well, thank you very much for giving me this opportunity. So as it sits right now, my father is at the Maples Care Home. As of yesterday, there was huge outbreak, 90 plus residents and 14 staff. All the people have been tested now, but I'm waiting for results. The bottom line is, even before COVID, I'm a very present person, and so are my brothers in my dad's life. We got to know the staff, and we already knew they were stressed to the max. There were so many things they couldn't do. There was often where I would hire private people to come in and give my dad additional supports. My dad has severe dementia, and if things changed in his normal routine, it would cause him a lot of stress in addition to his OCD that he's always had. So these people are doing their very best. I know that. But there was also a lot of turnover. And the turnover happens because there's a lot of part-time workers. They cannot afford to support their families, and they have multiple jobs. And I know that when COVID came in and the directive was you can only work in one facility, it was never disclosed that the facility could not be a hospital. So we know that some of these folks are working at the Maples and they potentially are cleaning at the hospitals. We know that they're working at superstores, Walmarts. They're working at other jobs. So all of a sudden, families were not allowed to come in. Dr. Gerard knows how hard I fought back in May to get back in because my father also doesn't speak any English anymore. And in a compassionate reasons, they allowed me back in. And so I was going for 30 minutes a day. And then you started to see there was less and less of the regular staff because they were too afraid to come in, or they had a better option someplace else. For dementia patients, that is so much stress. They don't know what to trust. This is a brand new person that just came in today. They don't recognize anybody. They need continuously routine and continuously seeing the same people. I know these staff at the Maples are doing their very best. I know them. They know me. When they sent me away last Friday, I did not go away without an answer because they weren't allowing me to come and see my dad. And I knew COVID was in that home. And I can pretty well put my money on it, that it was brought in because somebody got careless, because somebody had another job, and they have to make a living. We cannot continue to do that. And with COVID now, none of the families, we've been locked out for a week. I have had FaceTime with my dad because I push for it, but I know a lot of families are calling and not getting any answers right now. I'm still waiting for the results for my dad. I don't know if he's positive or negative. And whatever I do with him, because of his dementia, if I take him out, he'll go further down that hole of dementia, because what happens is every time they have any change in their environment, they lose more and more of their cognitive reasoning, their memory, etc. We need to do better. I am asking the Pallister government, the Minister of Health, we need to get Red Cross. I don't care who you get. We need to get additional staff to the Maples today, because there's more people that are going to be away in isolation. When I speak to the staff, they're scared. There's like fear in their voices. I keep saying to them, we're praying for you. Please be safe. Keep washing your hands. Tell me if you need me to translate for my dad. Call me anytime. But they're scared. We need immediate action in that home. I know Parkview is a disaster, worse than the Maples, and it's just going to get worse. This is not acceptable. This is not acceptable. I don't know what else to say.
Well, thank you. I think you've said it all. Thank you very much, Eddie. And again, you've just very briefly to say, what you said is so important, but the other is just the fact that so many, because of the way people are paid in these homes, and which we know has been a problem. There was a report that said it's absolutely known people are not paid enough, and they are not given enough hours to be able to look after people. And for people with dementia, it's absolutely critical to have more stability for them. And this is the issue, is that at the same time the government says, well, we're only going to have one person per home, they're overlooking the fact that so many people cannot actually afford to live on the salaries they are paid at these facilities. And they have to get outside work, and that's the only way they can feed their families and put a roof over their heads. So thank you so much for that, Eddie. John, I'll pass it over to you for comments and just to talk about some of the stuff we're proposing as far as acting as a seniors advocate for Manitobans.
Thank you, Dougal. Thank you, Eddie. The current COVID-19 pandemic has really exposed the major problems which have been long-standing in personal care homes. These personal care homes, for example, problems at Parkview, I first raised in 2011, 9 years ago. The Jan Lagaris at the Long-Term and Continuing Care Association of Manitoba has pointed out that the deficits in staffing and in funding go back at least 15 years. and the Manitoba Association of Residential and Community Care Homes for the Elderly has also pointed out that these deficits in funding and in staffing levels go back many years. So these are not new, but they have been exposed by the COVID pandemic. What we are proposing is that we need a seniors advocate. Cindy Lamoureux on our team has been advocating this for quite a number of years, but the government has shown no willingness to act. And so we are going to act for people as advocates. People can email us at seniorsadvocate@manitobaliberals.ca. We will work around the clock to make sure that you are supported, that your stories come forward, that anything and everything that can be done will be done. I have worked with Eddie and many, many others already. We've got a lot of experience in our team with me and Cindy and Dugald, and we're prepared to do this for the province because it's a shortfall and there's a dire need for it.
Thank you, John. And once again, basically, we have a situation where for many years, we have not had, one of the challenges for people like Eddie and for families and seniors across Manitoba is that they don't have someone to go to. They don't have an advocate, a definite advocate that they can approach. That instead, they have to talk to their MLA, and their MLA may or may not answer their calls. Their MLA may or may not speak up to the Minister of Health. We've shown that over the last months and years, we've been more than willing to stand up and speak up for seniors. To the Pallister government, John was standing up and speaking up for seniors. To the NDP government, this is something that has been a long, long time coming. This is not new, but it is absolutely critical that people have a voice. And it is so terrible because we've heard these stories over and over again of neglect, of it is simply not a way that people should be treated. People have, we have an obligation to make sure that seniors are treated with dignity, that they get the care they deserve. And the fact is the resources are there to make this happen. I will note that in the budget, the PCs are proposing, they're offering a tax cut to people who invest in gold. So the idea, if they can find the money to give that money away to people who invest in gold, they can certainly find money to invest in senior citizens and their care. We have an $800 million rainy day fund. And as Eddie said, we need to take serious measures right now, whether it is the Red Cross. We need to send people in to these homes to make sure they are safe. And as we've also suggested, that when people are tested and they are negative, if they can be removed and it's safe, they should be, but we have to do more. This is, the comparison to Ontario and Quebec is terrible because those are two of the worst places. There were two of the worst places in the world for seniors to be during the pandemic. So, and once again, I'll repeat, because the PC government is not willing to create a seniors advocate, Manitoba Liberals are willing to become that seniors advocate until there is one. And people can email us with their stories at seniorsadvocate@manitobaliberals.ca so that we will advocate for you to the Minister of Health. We will prepare a report. We will treat your information confidentially, and we will prepare a report about the state of personal care homes from these stories and present it publicly in order to show the desperate need for change. So I'll thank you, Eddie. Thank you, John. And I'll open it up for questions.
Great, thank you. So to any reporters, if you have a question, you can let me know if you have a mic in the chat and I can unmute you. Otherwise, you can directly type the question into the chat and I can read it out loud.
Hey, good morning.
Good morning.
Hey, good to see everyone. This is James from the Sun.
We can hear you, James. Go ahead.
Hey, yeah, good to see you. I'm going to ask the same question of Dr. Gerard, Mr. Lamont, that I asked you at the legislature, and that is, how on earth can a place like Parkview be accredited by the provincial government?
It's a really good question. One of the things which is, in a sense, extraordinary is that when the inspection was done to see if Parkview was up to date on March the 9th and 10th, when the pandemic was already underway and we knew what was happening, that inspection only looked at 12 of 26 characteristics. And one of the characteristics which was not looked at was the inspection or infection control. There is a big gap in the inspections, in the quality of the inspections, in the characteristic of the inspections, and this has to be beefed up because we can't let places like Parkview, which are so deficient, pass inspections and keep their accreditation without demonstrating that they have made major improvements.
Yeah, and just as a follow-up, if I may.
Sure.
Yeah, do you think that, excuse me, the idea of the elderly and family members being sequestered in a hellhole like this, it really bothers me. Do you think even in a pandemic, do you think that families have a right to get their family members out of places like this?
Yes. This should be a clear option, and the government should be putting forward a clear path for this to happen. Of course, family members have to demonstrate they have the capability to look after their loved one and have that plan in place. But I would think that it's up to the government to make sure that there's a clear and reasonable path for people who want to take their family members out of a care home to do so.
If I can, basically what we need is an emergency triage. We need to say, here are the people who are sick with, here are the people who are sick with COVID. Here are the people who may have to stay, but need to be isolated and kept safe. And then there has to be an option. If people are tested, if everyone should be tested, all staff should be tested, every resident should be tested. If they test negative, there should be the option for family to take them out and put them even in a hotel room that should be paid for by the government. This is what has been done in other jurisdictions routinely to keep people safe, where in places like Taiwan, I believe, they would test people, and while they were waiting for their test, they would put them in a hotel even for a day to wait and see whether it was safe or not, because that actually will, and these hotels should be staffed. We've been talking about this, proposing this as an idea for months, that basically saying, the government, look, if we've got a problem for hotels, rent hotel rooms and use them for public purposes. Use them to help family members, healthcare workers, people who have to self-isolate, and now seniors. There is space for this to happen. The problem here is a lack of political will. And really what's happening is, I said, this is the straw. The pandemic is just the straw that is breaking the camel's back on and showing just how terrible things have been for seniors for many, many years. Is that in Canada for too long, we've treated seniors as being disposable, or people to put in a warehouse or put away and not pay attention to. And successive governments, I will say again, John Gerard has been standing up and talking about this for years under both PC and NDP governments, and there haven't been changes. So we are absolutely committed to change. There is no justification in a country like Canada for seniors to be living in these conditions. We have the resources to turn it around and to make sure that people are safe and can live with dignity. So, so thank you very much for that.
Yeah, I don't want to take up everyone's time here. If these care home outbreaks if this is a case of too little, too late in places like Parkview, how bad could this get?
Well, I think what we're seeing, and Eddie is bringing out, is that The Maples Care Home is like Parkview was 4 weeks ago, that it is on the merge of, on the very edge of a potential disaster. And that now is the time, and we pointed this out in May, that you need to have health professionals who can go in there and guide or take over the care and make sure that things are done well and properly and quickly. The problem with the Pallister government is that they've been standoffish to the extent of the problems getting out of control. We now need what we called in May a rapid response team, that as soon as you've got an outbreak, they can go in and look very carefully at what's happening, be able to take over care if necessary, make sure that things are managed well. This needs people who are well trained, because one of the problems when you have an outbreak is, just as Eddie has explained, is that the staff get fearful. You get people not coming into work. You get people who have to self-quarantine. And all of a sudden, you find yourself very short of staff. And this is not something that a single home can manage well. You need the government, which has the resources, to have the backup resources to be able to go in and take over. Now, the Red Cross, as Dougal mentioned earlier on, has some experience in Ontario and Quebec, and they may be able to be helpful in this regard. But the major shortfall here has been the unwillingness of the provincial government to get involved very quickly as soon as there is a case in a care home and get on top of the situation instead of just standing back.
And if I could just comment on about two things, just to build on what both John and Eddie have said. One is what happened in Parkview Place, particularly, that it took 6 weeks after the first case for them to test everyone, which is unbelievable. The second is what Eddie talked about and John have talked about in terms of the workers. We keep hearing from this government that people are doing, they're calling people dumb for catching COVID, and they're calling people dumb for giving other people COVID. The fact is, this government has not made sure that people can work safely. There is no conflict or contradiction between the economy and making the economy work and keeping people healthy. If we keep people healthy first, the economy will follow. But what has happened is you have workers in care homes who are exposed to COVID, who risk passing on COVID as part of their job. It's not because they're going out to the bar. It's not because they're being irresponsible. It's because they're going to work, because they are doing their jobs and they have not been given the resources or the tools to do those jobs safely. And that is a colossal failure on the part of this government. They have not done the testing they needed to do. They have not invested in infection control. They have not invested in seniors' homes. This was preventable. It was 100% preventable. And this government learned absolutely nothing from the lessons of personal care homes, of the disasters in personal care homes across Canada and around the world. And they, as Eddie said, this has to change today. We cannot wait. They need, and they have to put their egos aside. They have to put their pride aside. They have to stop congratulating themselves over the great job they're doing, because everybody knows this is a fiasco. We are on the verge of going to code red in Winnipeg. And I'll add actually one other thing, which is incredibly important, because yesterday, St. Boniface ICU hit its limit. It went over its limit. There are, and this is important for every single Manitoban to know, because if you live outside of Winnipeg and you think, well, okay, Winnipeg's ICU rooms are full, what's going to happen? There are no ICU rooms north of Winnipeg for the entire province. We have ICU beds in Brandon and in Winnipeg. If you have a heart attack in Thompson, if you have a stroke in Dauphin, if you have a car accident in Selkirk, you are going to have to go to an ICU in Winnipeg or Brandon, and they are filling up. So it's not just COVID cases. The fact is if you face a personal health crisis that requires an ICU bed, it might not be there for you because this government has completely mismanaged this pandemic. And the excuse, their excuse has basically been, well, everyone's doing it because there have been failures around the world. That's not good enough. So again, thank you very much. I don't know if there are any other questions, but I want to thank John and Eddie.
Yeah, thank you so much. I appreciate your time.
Okay. Thank you.
I did receive.
Have a great day, everyone.
Thank you, James.
I did receive one more question through the chat. Can you talk about the role of public personal care homes versus for-profit personal care homes, and
if I might,
going forward? Yeah.
I mean, basically, I think we need to consider eliminating for-profit homes, because the fact is that they have an incentive to cut corners. They have an incentive to pay people less in order to pay shareholders. And the outbreaks that we're seeing are often in private homes. The same thing happened in private homes in Quebec and in Ontario. I know that there are some fantastic homes which are privately owned in Manitoba, like Thorvaldson, which are absolutely exceptional. So doesn't have to be a blanket rule, but we have to make sure that there's a standard of care for seniors. And there have been CBC reports that showed that in home after home after home across Canada, things happen to seniors that would lead to a criminal conviction if they were done at home, and they get away with it. And it's not acceptable. If it happened to a child in a daycare, somebody would be arrested. If it would happen to somebody's home, if somebody treated their parent like that at a home, they would be arrested. But when it comes to personal care homes, we are not seeing that kind of enforcement. And part of it is that governments have not been willing to do what it takes. And this crisis has really, like I say, has broken the back of these personal care homes and shown really what it's like. Because when it comes to the inspection at Parkview Place, that inspection that happened in March showed that there had been a cockroach infestation that hadn't been addressed at that time for a year. When the NDP brought that up, the Minister of Health pointed out that cockroach infestation has been there since 2006, and we are hearing that it may have been there long before that. So we have basically let these things slide because people have just been willing to treat seniors as less than, and that's not acceptable.